Greetings. Welcome to my YouTube channel. This is Mushtaq Memon, Professor Emeritus from Washington State University. This is the second part of our pregnancy problems in the female dog. I discussed some of the vaginal discharge problem during pregnancy in my previous video, and this is a continuation of problem in mid to late pregnancy. So I will just go ahead and start with my case report here with the Cocker Spaniel with name Abby, 4-year-old. She had breeding done 3 times in April on 23rd, 25th, and on 30th. She had ultrasonography on May the 31st. She had 3 fetuses in the left horn with a heartbeat, but there were 2 fetuses in the right horn with no heartbeat. So I always try to quiz our trainees, what do you do in these kind of situations when you've got these 2 horns of the dog? One has live puppies and one has the dead puppies. What could you do? So there's always a live discussions, and I admire our young people, especially our students, who try to come up with some innovative ideas, like trying to, cut one horn off through surgical means. So when we try to discuss about the potential production of prostaglandins with inflammation, what happens to the live puppies? So it becomes very challenging, to try to figure it out what to do. So from there on June 10th, 10 days from the last examination, vaginal discharge became thick and mucopurulent. And we did the ultrasound, and all puppies were dead, with the pus and the blood there. As you can see here, a pretty disgusting discharge, from the vagina. So the client was very determined that she wants to breed this dog again, but she wants to have this uterus cleaned, so to speak. So just to oblige her, we went ahead and opened that uterus up and then tried to, lower the uterus. And its endometrium was pretty, so to speak, dirty. One of our residents was really concerned that we shouldn't be doing these things because this is kind of not humane to try to have this kind of uterus intact. But sometimes you have to oblige the client if this is something not really that bad or unethical. So I just obliged the client. I said, okay, we will do that, but you are going to stay in touch and see what's happened to this animal. We did suggest them that our recommendation would be that we go ahead and spay the dog, but the client did not agree. So we removed the sutures, and animal was doing fairly well. And ultimate goal was that she wanted to breed her again. So she came back in estrus after about 8 months, and she was bred, and she had normal 4 puppies. So this really tells you that how much we know. And so the client was happy, and we were pleased with it, that whatever she wanted to do, she got it done. So by the way, this whelping was done on her own. There was no C-sections or anything like that. Then I bring you to Shamu. Shamu is a Newfie dog, Newfoundland. I like really the dogs. They're very big, and they sit in your lap like a big blanket, and they drool a little bit, so it's kind of very interesting to deal with these animals. She had 3 previous litters, and she was 63 days from last breeding. You remember in my earlier videos, I discussed about 62 days pregnancy on average, but also I mentioned there could be a range somewhere from even as early as 59 to as late as 65, 66 days. So the rectal temperature was 37 degrees, which is fairly normal, but she had this brown, thick, non-smelly kind of discharge coming out I mean, she's a black colored dog, so you really cannot appreciate the darkness of this discharge, but I'm sure you are able to at least appreciate some. On the radiograph, she had two fetuses. And so on ultrasound, as you can mention here, that one fetus was facing caudally with a heartbeat, and other cranially did not have heartbeat. So again, the question was what to do next. So we went ahead and did C-section in this dog because this client was really anxious to get this one puppy out safely. So I think that was the outcome of this C-section, that one live puppy was delivered. So really based upon these two videos, one previous one and one this one, having this vaginal discharge during the pregnancy at different times of the pregnancies have interesting outcome. As you can see here on these four cases here. But I think the bottom line is that we have to really take a good history and then have a pretty thorough clinical examination. Have to confirm pregnancy because the animals could be in pseudo pregnancy, not pregnant, and having all kind of different histories. But you have to really confirm all that with the ultrasonography if a question is asked. And then, to be honest with you, it is more like a symptomatic treatment. What you see, what you find, and then you go along with it. Obviously, client has to agree with some of your, decisions, whether C-section or by time and how these animals could go. We published this paper, in fact, on these clinical, problems of vaginal discharge because I'm sure many of our practitioners see this thing, but there's nothing written on it. So this was published, so you're welcome to get hold of this paper and keep it for your future references. Until then, I'm going to ask you to send me some questions and comments on my YouTube channel. We'll be happy to respond. Until then, take care of yourself. Bye-bye.